All right, we are live. Welcome to the first meeting of the 2025 session of the Health and Government Operations, Public Health and Minority Health Disparities Subcommittee. I'm Delegate Heather Bagnall, Chair of the Subcommittee. We have one bill to consider today, which is House Bill 170. This is the Maternal and Child Health Population Health Improvement Fund use. And we heard this bill hearing last week. It's a very simple bill, and I'm going to turn it over to Aaron to talk us through, and then we'll open it up for any questions.
This is a departmental bill, and the bill extends from December 31st, 2025 to December 31st, 2027, the date through which the Maternal and Child Health Population Improvement Fund may be used for maternal and child health population health improvements. And this bill would allow the Maryland Department of Health to spend through calendar 2027 any monies that are remaining in the fund as of December 31st, 2025.
Thank you very much, Aaron. Just a reminder to our members, this was a special fund that was created to support maternal morbidity health outcomes. And let me open it up to the members if there are questions. Delegate Chisholm.
Thank you, Madam Chair. When I was looking at the fiscal note, it said HSCRC advises that by the end of fiscal 2025, the fund will have a balance of 24.1 million. And I'm going to ask a question, but we can hold it for a second. Is that what we're looking at now? And then it says a portion of that estimated balance may be spent between June 30th, 2025 and December 31st, 2025, which is that 6-month gap there. One, could we spend it all? Two, do we have 24.1 million? And three, this is not increasing any revenue at all. That money is actually just there. We're just trying to figure out how to spend it and what's the time period to spend it. Am I correct on this?
You are correct, and this is a fund that's currently supporting several programs, the home visiting services, the mom program, the doula services, Healthy Steps, and the centering pregnancy program. So these are existing programs. I see Ryan Moran nodding his head vigorously. Do you want to go ahead and speak on this and address Delegate Chisholm's questions?
Sure. Thank you, Chair Bagnall, and good to see members of the committee. Just want to validate too the expenditures in terms of the balance is to be 24 million, as to your point, Delegate Chisholm. And again, I think it's important context in terms of the committee to understand the significant amount of undertaking that has gone through the process that the department has to build the infrastructure to really support the launch of these new benefit programs. You're talking things from centering pregnancy program to maternal opioid misuse programs to doula provider certification of organizations that have grown from 90 to 30 in the Medicaid program, even within the last 6 months, as we've been working on that. So we have been hard at work in terms of establishing a very strong baseline for these funds to continue to be expended and used. And Delegate Chisholm, you are right that the request of the bill is to ensure that what is left, if you will, remaining within those particular funds that currently exist is able to be extended into 2027 now that the Department and Public Health Services and HSCRC have worked to really develop the strong infrastructure in Florida to support the programs moving forward in the future.
Okay. So not an increase in spending, it's existing funds, and
Correct.
We're trying to figure out.
That's exactly right. Yep.
Okay. Thank you.
Absolutely. Delegate Hutchinson.
Thank you, Madam Chair. I want to get a clarification. This 24 million is staying dedicated into this fund, or did I see that 10 million of it is being transferred over to the general fund in the budget?
So I think a couple of things I want to mention on that. So the first is there is a BRFA provision that currently exists in terms of that on or before the 30th at the end of this fiscal year in 25 of 26. That 10 million could go to general funds. What I would advise the committee is that the sunset extension of these funds are needed in order to buoy us through this fiscal year and the next fiscal year So doing so will certainly guarantee the particular support of these particular programs. I will also advise if this bill does not pass, this means that all of the provisions and services that are currently being provided under this bill's provision, doula services, centering pregnancy program, maternal opioid misuse, all of them, there are additional more, asthma, et cetera. Those benefits would end. So we would stop offering those to Medicaid participants as of December the 31st, 2025. That is why the sunset is needed. And yes, there is a BRFA provision that exists that you're discussing about, but it is to support in this particular fiscal year and the next fiscal year.
Just clarification, what would trigger then the 10 million going to the general fund? Or is that definitely going to happen?
I don't know if the BRFA specifically outlines what would trigger that, but I presume and certainly would want to check back internally that there would obviously have to be a balance of the 10 million being available at that point in time.
Okay, but if it did, then it would significantly impact this program.
I think that's what the BRFA provision said. But what I will say is that we recognize and understand that the funding in terms of the sunset, in order to fulfill the obligations that we have for the rest of fiscal year 25, as well as carry us to funding, regardless of the BRFA provision into the next fiscal year, they would be needed to ensure that the continuity of those particular funds and services.
Okay, Madam Chair, can I have another question, please?
Yes, go ahead.
So what was the size of the initial fund?
My understanding, it was 10 million per year, so 40 total. Deb, Laura, track me on that.
Correct.
Yep.
But in that time frame, we've not spent that amount of money, and this is
correct. So the estimated is the $24 million that remains within the particular fund. And again, I point back to the confluence of a lot of events, the infrastructure build it takes to build out some of these programs, which are huge lifts. Also COVID and sort of responding to COVID and getting providers back up to normal, I think had an influence on the ability for the department to really have a strong out the gate to ensure that these benefits are accessed by participants.
Perfect. Thank you.
Yep. Thank you, Delegate Hutchinson.
Delegate Riley. I see a hand from Delegate Riley. Oh, you're still on mute, Delegate.
Sorry about that.
We're all getting back to the swing of it.
Okay, so we have the 24 million left that we want to spend, and we don't feel like the current sunset will get that spent. So I understand the sunset changing to 27. Once 27 comes, then we've hopefully have spent the 24 million to where it goes to these programs. What happens then? I mean, is the programs are now in full force and we have to find the money elsewhere after 27?
Yeah, great question, Delegate Riley. So these special funds, presuming it goes to the 27, right, and they're all expended. Obviously, the department has worked very hard to ensure that these startup fundings that were available through the Health Services Cost Review Commission as part of the special fund ignite the ability for participants to take advantage of these services. And the Maryland Department of Health and DBM in future budget cycles would be working on long-term sustainability once the expending of the fund.
And so at the end of that, will there be any additional federal matches, or this is
all of the funds that
because
are
it's
currently
Medicaid.
available offered within the Medicaid program, Delegate Riley, would continue to be matchable even after the sunset, right? So they're documented within our state plans or other types of authorities so that they will continue to be matched, even after the funds expended, and we have to come up with sustainable other fund sources that are available to answer your question.
Gotcha. Do we have any I'm sorry, Madam Chair, one more question. I'm sorry.
Go ahead. Go ahead. We want to make sure we understand what we're discussing, what we're voting.
Okay. So at that point, I mean, how much do we have any idea, like years out after 27, what that fund would have to be, that, what our match would be? Do we have any idea once these programs are up and running? Is it going to cost us more once they're running, or what's the average amount you think that we need a year?
I think an estimation, which is why the assessment was applied, of around $10 million when we sort of did the work. That's what we had thought between all of the collective programming together. Obviously, we're going to keep a close eye on this in terms of utilization for services and to see if that changes over the course of time in the next couple of years. And that's something certainly that we'll be watching, especially as it pertains to future budgetary considerations. Yes.
So you think per year, 10 million, but probably a little more because you said you just added within the last 6 months, quite a
Yeah,
few more.
I mean, those are our best estimates in terms of what
Okay.
was provided at the time. Yep.
Thank you so much. I appreciate it.
Thank you,
Thank
Delegate
you, Madam
Riley.
Chair.
Thank you. Delegate Hill.
Thank you, Madam Chair. I'm going to follow up on Delegate Riley's question. Do we, you said that on out years, we would still be getting max. Is that subject to federal reconsideration? In other words, are we assuming that the feds will continue to do? Or is there a possibility that the feds will change direction and decide that they're not going to be sending any of these funds to the state? Or is this separate money that they, is baked in to just the Medicaid program differently, this matching funds?
Yep. Thank you, Delegate Hill. So this is these services that we currently are offering are all documented for federal authority for us to receive the federal match at this particular point in time. Obviously, we're all watching sort of changes that could happen on a federal level in terms of if there's any parameters that set on federal matching dollars that are available to the state. But at this current juncture, all of these are within our authorities, and we expect, unless there are some other unforeseeable circumstances that might change in terms of federal match policy provisions at the federal level, that those would remain in place for us to receive the match.
Thank you.
Yep, you're welcome.
Thank you very much. And just so that we have a little bit of context, this fund was based on recommendations from that go back to 2019 when we worked with the maternal morbidity and mortality review board, and we realized that there was disparity in our data reporting and that Maryland was behind the national average in terms of our maternal outcomes and population health outcomes. Is that correct? Who can answer that question?
Yes, Laura, do you want to talk about that work if you want to opine any further on the history there? Laura Goodman has been with us from the beginning, our Deputy Director of Innovation Research and Development from this work.
Absolutely. Thank you to the committee for the questions as well, Dr. Moran. So yes, there was a resulting from legislation back before the pandemic, there was a maternal health task force, and a lot of these recommendations did stem from the recommendations that came out of that group. And then to provide additional context, and if the HSCRC would like to weigh in on that as well, under the total cost of care model in 2020, I believe, resulting from work groups, maternal and child health, particularly childhood asthma, as well as severe maternal morbidity, were identified as population health goals under the state, which in turn generated the availability of these funds to support the department in those efforts.
So this was a fund that was created to support evidence-based initiatives to improve our overall health outcomes for moms and babies. Is that, I'm seeing a lot of heads nodding.
Yes, for these, yes, Chair Bagnall, for these, very specific dedicated uses that Laura and the committee, I know, reviewed in detail with all of you in terms of the work that's happening, and really to address the disparities that exist in the state of Maryland and in this particular space that's important to this administration as a priority as well.
And so the bill that you brought to us is just changing the date to give us more time to expend funds to expend the funds for these existing programs.
That's right. Yeah, it extends that sunset date out to the end of 2027.
Got it. Thank you very much. Delegate Chisholm, you had another question.
Yeah, since we brought it up, so I know we're in this bill, we're just talking about the extending the date, but in the original bill, were there any mandated reports to come back to us or data so we can see? Obviously, whenever we're spending money, we want to make sure the money is having a return on investment and we're seeing positive results. I'm assuming you guys are studying some of that, and do we get reports on that?
We absolutely are. And I don't know, Laura, you can correct me if it was part of legislation or not to do a mandated report on that. However, we do have an evaluation report of some of the work that's taken place thus far. And we had talked this morning at the department to ensure that you all as the committee receive a copy of that report. So we'll ensure that you have that, and we'll send that Chair Bagnall to you and others. It was a collaborative work between Medicaid program, public health services, as well as the HSCRC.
And I can also expand on that we actually did get a report in November of 2023, and I'll make sure that the subcommittee has that.
Yep, and we have a,
we got the program 2-year FY 2023 annual report
yep, and we have the 2024 report that we just finalized.
that we
will
just
soon be
finalized.
coming. Yep.
Yeah, I know because it sounds like it took you a long time to set up the infrastructure and all the logistics and maybe didn't see results. So the latest results would be great to take a look at that, that you're seeing improvement. Thank you.
Absolutely. Do we have any other questions, concerns, anyone who wants to be heard? Do we have a motion on this bill, House Bill 170?
Move favorable.
Second.
All right, it's been moved and seconded. Any further discussion? All right, all in favor of House Bill 170, please say aye or raise your hand.
Aye.
Anyone opposed, go ahead and say aye or raise your hand. All right, Delegate Riley is recorded opposed.
Yeah, I just would like to wait until I saw the report and actually see
reports?
the programs that, that the bill requires and what we're doing with it, and is it effective and not effective. So as soon as I get that, then I could change my mind in committee, but right now. I'll vote.
Absolutely, thank you. And thank you for that, Delegate Riley, and we will make sure that we record accordingly. So House Bill 170 moves favorably, not unanimously. The Maternal and Child Health Population Health Improvement Fund use to move the date from 2025 to 2027. Thank you all very much for your hard work and for your due diligence ahead of this meeting. And with that, do I have a motion to adjourn?
So moved.
Second.
Second.
All in favor?
Aye.
Aye.
All right, we are adjourned. Thank you very much for all your hard work, and I will see you in committee in a couple of hours.